Meanwhile, one local pediatrician says it's important that parents have all the facts before choosing not to vaccinate their kids against the flu. News Source 16's Carly Gomez is live in studio. And Carly, the local medical community is on high alert right now.
That's right, Amanda. It's still too early in the flu season for the CDC to know for sure just how good a match this year's vaccine is to the flu strains that are going around. But one pediatrician says it's the best protection we've got, and it can and does save lives. Dr. Pilar Bradshaw says she's concerned parents may decide not to vaccinate their children based on this recent tragedy, and she thinks that would be a mistake. She says no vaccine is 100%, but it is a good defense.
It's kind of like if you got in a car wreck while wearing a seatbelt and died. We wouldn't all look at that car crash and say, well, because that person was wearing a seatbelt and they died anyway, we're all going to stop wearing our seatbelt. It doesn't make any sense. You have to take the best that you've got for prevention, which at this time is the flu shot.
Dr. Bradshaw says it's complications from the flu like pneumonia and brain infection that leads to deaths. On top of getting the vaccine, Dr. Bradshaw says washing your hands often is also very important. Also, do not send your sick children to school or daycare until they have been fever-free for 24 hours. And for children who are old enough, train them to keep their hands away from their faces because the eyes, nose, and mouth are the main ways the influenza virus gets into your body. Live in the studio, Carly Gomez, News Source 16.
Thanks, Carly. There have also been questions over the last couple of days about using the antiviral drug Tamiflu in treating people with severe cases of influenza. Dr. Bradshaw says Tamiflu was designed to be given within 48 hours of sickness to reduce the severity and how long mild cases of the flu last. Several large studies have been done to see if Tamiflu could reduce a person's risk of serious complications, but the results are mixed. And doctors say there are also significant side effects with Tamiflu.